Good evening, everyone. Myself, SINGH, Assistant Professor, Mira Medical Institute of Nursing and Hospital, Abohur. So, today I am going to explain about the topic of national health programs that will include the part 3 of the same topic, but the subtopics would be different in this lecture. As in the previous lectures, I have already explained you about the various types of health programs like the ICDS, National Anemia Control Program, National Tuberculosis Control Program, and a revised strategy, and the National AIDS Control Program. Okay, so in today's lecture, I will I will explain you about the National Rural Health Mission, and the second topic would be the National Mental Health Program. Okay, so I am continuing with the topic. So first topic in today's lecture would be the NRH. So that is National Rural Health Mission. So as the name indicates, this program or the mission was launched or planned by the Indian government with the help of the state governments. It was implemented and it was launched in the year 5th of April 2005. And the main objective of this program was to rebuild the rural India so that we can provide the accessible services, or the services should be, there should be the access of the services to the general population that is living in the rural areas. As I have already explained you about that 70% of the India's population is residing in the rural areas. So most of the cases of the various types of communicable and the non-communicable diseases, I would say, uh, they are reported from these types of from the rural areas. So taking into the account of this specific thing, the government of India launched a national rural health mission uh, and launched it on the 5th of April 2005. So there were different approaches, and before coming to the approaches, I would like to explain you something that rural areas, the rural areas, we are having a large population of the India's population, I would say. So there is scarcity of the resources. We are having the limited resources, but we are having a large number of people of the population, as we are at the second number at the world level in the if we talk about the population. So uh, taking into this thing, taking account, uh, focusing on that specific thing. So the government of India think that, or the planned mission that would be able to provide the services, or there would be the access of the services of the uh, health services, I would say, specifically to the rural population, because this plan is completely focused on the providence of the services, health services, or other services that are needed for the survival of the population or the citizens of the specific country. So the basic needs, one point in this program was to complete, or to complete the objective of completing the basic needs of the population. That includes the various things like the nutrition, sanitation, drinking water supply, and other health and health allied resources. Okay, so that was about the introduction of this topic, that is National Rural Health Mission. Okay, so that was the basic concept behind this topic, that why this program was launched in the year 2005 and what was the need of for the implementation of this specific program to implement at the national level. Okay, next I will explain you about the approaches. So there were different approaches of this program. That includes, approaches means to say that we were targeting on the specific points, and these points are written here under the top term of approaches. So what we were trying to target was, first of all, was the nutrition. So nutrition is a basic need, I would say, of the general human population. So if the population is lacking in the basic nutritional services, then they will have to suffer from the various types of nutritional deficiency disorder that might either be due to the micro as well as the macronutrients. So the nutrition was the basic and the first approach that was included under the approaches. Okay. Second is the sanitation. Sanitation is a very important point uh, because it is the if we are not able to maintain the proper sanitation in a country, like for example, the in India, the government has to deal with the problem that is a major problem in India, that is defecation, open defecation problem. So from this reason, for this reason, the a major population of the India has to suffer from the various type of fecal oral route, the diseases which are transmitted to the fecal oral route, or other type of waterborne diseases. So due to the non-maintenance of the sanitation at the country level or the national level, so India was facing uh, the Indian population at this time was facing with the burden of the various types of communicable and non-communicable diseases. So the second point, that is the reason that second point here written is the maintenance of the sanitation. Okay. Next, third is the safe drinking water supply. That is the basic need, and I would say from the first 5-year plan, if we talk about the first 5-year plan, so from the very beginning of the first 5-year plans or the 5-year plans, and from the last 70 years, that is the point or the objectives which till date is not achieved by any of the 5-year plans or any of the program. As I would say that safe drinking water supply and sanitation program is also there at the national level, but still we are not uh, able to get the safe water or the drinking supply, and the general population of the citizens of the country has to suffer, or they have to drink the unsafe water, and the water supply is not safe. Okay, so that is the third point why this approach was chosen under this mission. Next and last one is Ayush. Ayush, Ayush includes, first of all, is the Ayurveda, Yoga, Unani, Siddha, and Homeopathy. So that is not a single word. That is a word that is having the different meanings, or there are the different types of, I would say, the different medicine systems like the homeopathy, Ayurveda, Yoga, Unani. Ayurveda and Yoga are the ancient medicine systems that are believed to be the uh, mother of the various medicine system that exist in today's world. Or if uh, I can say that the Ayurveda is uh, from Ayurveda, there are the different medicine systems which are existing nowadays in the world. They have taken some of the points from or the teachings from Ayurveda, so they have developed their own medicine systems. Okay, so and yoga is also the same. Okay, so that was about the major approaches that were covered under the National Rural Health Mission. Okay, next is the aim. So what were the main aims of NRHM? So first, there are 5 points that are these are written here. The 5 words are: first is the main aim of NRHM is to provide the accessible, affordable, accountable, effective, and reliable primary health care. So that was the main aim of a National Rural Health Mission. That is accessible. That means each service has to be provided to each and every citizen of the country, and without the any type of barrier like the religious or the cultural or any type of the geographical barriers. Each and every health service should reach by the each and every citizen of the India. Okay. Second was affordable, as we already know that the healthcare system in today's world is very costly. As if a financially fit person uh, is suffering from any type of chronic disease like the cancer or any other type, then he or she might become uh, I would say that uh, the disease would result in the uh, financial loss for the that specific person if he or she is suffering from the any specific disease. Okay, so that is the reason the health services in a country, or especially in India, it should be the affordable services, like we are doing in the primary health care system, that it is written in the definition of the primary healthcare system that the health services must be provided at a cost effective level that the community and country can afford. Okay, so that was the second point, affordable. Third is accountable. So the main point is not just to provide the access of the services, or the services should not be only be the affordable ones, but they should be the accountable ones, that the persons who are responsible to for the providers of the services, they should provide the quality services. Okay, so that is what we mean by the term accountable. Next is effective. So services should be effective. There should be the providers of the effective services. And next, reliable. So the services should be provided at a level that the community and country can rely or believe on that these type of services. Okay, so that was about the main aim. And some of the other objectives or the aims written here are: first is rural health care through the creation of cadre of ASHA workers. So one of the aim under this program was for the formation of an army, I would say, of the ASHA workers that would provide, or they will be responsible for the providers of the services at the grassroots level, that is at the village level. Okay, next is National Vector-Borne Disease Control Program against malaria, cholera, dengue fever, etc. So, National Rural Health Mission, or NRHM, covers the various types of diseases, and in a coordinated manner, various types of diseases. Various names are written here. So they were targeted under this program, and a coordinated program for these diseases to fight against these diseases were implemented. That is, under the National Vector-Borne Disease Control Program was a program was launched under this program of the mission. Next is plan of action. So that was about the aim. Next is about the plan of action. So what were the various plans that were implemented under the NRHM? First of all is the creation of the cadre of ASHA worker, as I have already explained. Second, and the most important is, one of the most important is strengthening the sub-centers. So each sub-centers cover a population of 3,000 to 5,000. As some of the things included in this uh, intervention was supply of the essential drugs, both allopathic and the Ayush, to the sub-centers. Okay, so the word here written is the strengthening of the sub-center. Okay, so for the strengthening of the sub-center, we have to provide the various essential services like the medicine that are essential drugs, both allopathic and Ayush, so that the uninterrupted drug supply should be provided to the patients or the sufferers. Okay, next is the strengthening of the sub-center, and that was about this. Next is the strengthening of the primary health center. A primary health center covers a population of 20,000 in the rural areas, and in the hilly areas, and 30,000 in the plain areas. Okay. Next is strengthening primary health center, and how would it be done? That is first point, strengthening PSC for the quality and preventive, promotive, and curative services. So there was under this point, the quality of the services was to be improved under this program, and preventive, promotive, and curative services were to be provided at a single level. Okay. Next, adequate and regular supply of the essential drugs and equipments to the PSC, like the DOTS therapy or any other type of therapy. For example, some of the diseases that have to be treated at the emergency level or immediate level, for those the treatment of those type of diseases, there is a need of the uninterrupted drug supply of the essential drugs. So that is why the point here written is supply of the essential drugs, and in this way we will be able to strengthen the primary health center, various primary health centers at national level. Next is provision of 24-hour services. So not just the services provided at the primary health center, not just be limited to the morning or the evening. There should be the provision of the 24-hour services, so that at any time the general population, the rural areas, can get the services from these type of centers. Next is standard treatment guidelines. So the standard treatment guidelines should be issued by the government of India under this mission, so that each subcenter of the primary health center should follow these type of guidelines, so that they should be maintained under the similar guidelines. Okay. Next is upgradation of all the PSCs for 24-hour referral services. Not just the providers of the services, but each and every PSC should be equipped with the various transport services, so that there should be the possibility, if there should be the need of the referral of the patient from the PSC to the CSC or the first referral unit, it can be done in an easy manner. Okay, so that was the point, upgradation of the all the PSCs for 24-hour referral. Okay, so mostly this referral is done during the MCH services, during the providence of the MCH services, and any type of complicated deliveries, or in the condition either there is a risk of the life of the mother or the fetus. Okay, next, providence of the second doctor at the PSC level. So that was also a point added under the plan of action. Next, so that was about the strengthening of the sub-center and primary health centers. Third point is the strengthening of the community health center. So that is the third point and the important one. Each community health center covers a population of 80,000 to 1,20,000 1,20,000. So that is the population covered by a single block in an area. Okay, block is of 100 villages, and there is an in charge, that is block development officer. So the population covered by a block is similar to the population covered by a community health center. Okay, so we can say that a community health center cover a population or the villages, that is 100 villages. For 100 villages, there should be the provision of a single community health center. Okay, next, some of those points under this point is operating all the 4,276 existing CSCs as 24-hour first referral units. So at that point, when this program was launched, this was the main objective, that the then existing CSCs were to be strengthened for the 24-hour referral services, as I have already explained you about in the primary health center. Next, condition of the new public health standards. So new public health standard guidelines must be followed under the community health centers. And next is setting up norms for the infrastructure, staff development, and management. So without the norms, we can provide accessible, affordable, and any type of accountable and reliable services. So norms should be set for the infrastructure, what should be the staff, and what should be the equipment, and how would they be available, and their uninterrupted supply would be there, and it should be ensured that the uninterrupted supply of the equipments and the drugs or the medicines, and this should be managed at the various levels, so that in this way we would be able to strengthen the community health center. And last, developing standards of services and cost in hospital care. If we are not providing the qualitative services, then we are not providing the good services. So there is a need of the providers of the standardized services or the quality services. We have to provide both the qualitative as well as quantitative services. But if the quality is missing, then the services will not provide any of the benefit to the citizens or the population of the community. Okay, so that was about the strengthening of the community health center. That was about the what was the main approaches and the aims, and what was the plan of action of the NRHM. Next, NRHM infrastructure. So what was the infrastructure that was decided at this point? First, provision of a mobile and medical unit at the district level for outreach services. Outreach services, that means are the areas we have to provide the services at the areas which are difficult to access, or the health personnel can't go to these type of areas like the hilly ones or the any type of the distant places in which the persons are living, but they are not approachable by any type of the comfortable transport. So in this infrastructure, we are also covering or we are also providing the outreach services, so that we can also cover the distant places. Okay, second one is health services are being currently provided by the private sector. So there should be the involvement of the public-private partnership. It will be explained in the next fourth point. Okay, so not just only the public sector, but we also need the provision help of the private sector. Okay, next, private sector as a part of the RCH initiative will provide effective healthcare delivery system. So as I have already explained that on not only the public health sector, but we are in the need of the private health sector to the providers of the services, especially in the RCH initiative, that is Reproductive Child Health Program. Okay, so if we want to run our healthcare delivery system in an efficient manner. Next, thus setting up a public-private partnership. So that is the point that I was talking about, that PPP, that is public-private partnership, to make the RCH program true and ensure availability of the prevention and curable reproductive and child health services to the community. And especially it is mentioned here under the RCH program, we are in the need of the public-private partnership so that we can provide the effective services related to these programs. Okay. Next is the major components of Nrh. So what are the major components? First is provision of the additional generic drugs at subcenter PSCs and CSCs. So generic drugs would be available at these centers so that the cost-effective services of the medicine could be provided to the at the subcenters PSC and CSC levels. Next is operationalization of the village health plan. So for each village, the health personnel responsible for the health status of that area, they should be having a village health plan that should be implemented by the village health guides or any of the other personnel that are responsible for the health status of a specific area. Next is prevention of the village health plans. That is not prevention, that is implementation of the village health plans. Next is ASHA at the village level should be there to the providers of the services at the grassroots level, and upgradation of the rural hospitals. If there is the availability of the rural hospitals like the PSCs and the CSCs, they should be upgraded for the tackling of the diseases of the new time. Okay, so upgradation of the rural hospitals is a very important point under the major components, and they should be upgraded by the financial services or any other type of equipments and drugs or the health personnel. Last one is the wild medical units at district level. So there should be the providence of the wild medical units at district level. So if the people are unable to come to the hospital should go to the people through the home visiting. The health person should perform the home visiting and assess the general population or the citizen of that specified area so that we might be able to cover the population at a large level for the prevention and control of various types of communicable and non-communicable diseases. Okay, so that is about the major components of Nrh. So that was about the Nrh, that is National Rural Health Mission, launched on 5th of April 2005. That was a very important topic. It can be in the exam, asked in the theory exam or either in the practical examination. Okay, so you should or must focus on that specific program. Next, second one is the second program for the today's classes, National Mental Health Program, and as the name indicates, it is the program that is for the mental health, not physical health. It is for the mental dimension of the human being. So that program was launched in the 1982. And it was named as the National Mental Health Program. So there were some objectives of this program. First was to ensure availability and accessibility of the minimum mental health care for all in the near foreseeable future, particularly to the most vulnerable sections of the population. So first point was to provide of the services, as all of us focus mostly on the physical dimension of our body and very less persons from us focus on the mental health. For example, the vulnerable groups like the children, mother, or the aged persons. Okay, so most of the diseases uh, of the mental health dimension, okay, the person suffering from the mental illnesses are from these vulnerable sections. So first objective was to provide the services related to the mental health to these people. Okay, second, to encourage mental health knowledge and skill in general healthcare and social development. So not just the physical health, but also to promote or to motivate the people for the mental health, improvement of the mental health, that the person should maintain their physical as well as the mental health. That was the second objective. Through that the general population was to the government's initiative was to aware the general population about the mental health issues. Third, to promote community participation in the mental health services development and to stimulate self-help in the community. Okay, so third point was to promote the community participation in mental health services. So different types of mental health services are implemented under the different programs by the government of India or the state governments. So that was the point written here is the self-help in the community. By own efforts, the community members should perform their own efforts to get these services that is provided by the governments. So these were the main objectives under this program. Next is uh, who are the main persons that are involved under this program. So some of the persons like village health guide, second is the health worker, third is the health assistant, and the medical officer. So these are some of the specified persons that are involved or they work under this program for the providers of the mental health services. Next is the district mental health program. Like I have already explained you about the National Tuberculosis Control Program that was also implemented at the district level, the District Tuberculosis Control Program. This program also contains the same or similar topic, that is District Mental Health Program. Okay, so if we are doing a thing at the mass level, then we are dividing it at the different levels. Like a program is launched at the national level, but to make it effective, we will uh, again implement it on the like the state levels, then at the district levels. So to increase the effectivity of that specific program. So that is why a program named that District Mental Health Program was launched in the year 1996. Okay, and the main components under this program was early detection and treatment of the mental health illnesses. Second is training of the general physician for diagnosis and treatment of mental illnesses. So there should be the provision of the general physician, not the specialist ones, but the general physician should also be aware about the mental symptoms of the mental illnesses, so that we can have the assessment of the cases of the mental illness under the general population. Next, third one is the IEC, that is information, education, and communication. That is very important to inform the people about the various types of mental issues. Then we are educating the people about that how would we be able to prevent these type of mental illnesses. And third is information and education and communication. We are communicating the knowledge or the information related to these mental illnesses and their preventive measures, so that we might be able to save the general population from these mental illnesses. Next, monitoring, the purpose is for simple record keeping. So also we have to maintain the record of the various types different cases. Okay, so that was also the objective. Next, I am going to explain in detail about the district mental health program. So, under the district mental health program, there are different objectives like the provide community mental health services and integration of mental health with health services through decentralization of treatment from especially mental hospital-based care of the primary healthcare services. A DMHP investigates a community-based approach to the problem. Okay, so there are different objectives under the district mental health program. Okay, so they are implemented under the at a decentralized level. Okay, so different objectives are first training of the mental health team and identified nodal institution. So uh, let me explain you about that. This is a fact that we are having a scarcity of the uh, mental health manpower related to the providers of the mental health services. We are having less hospitals, other specialists relating with the mental dimension. Okay, so that is why a point here written is training of the mental health team, so that we should be having the manpower related to the mental health, and scarcity should be there should not be any type of scarcity related to the manpower. So that is the first point. Second is awareness and reduce stigma related to the mental health problems. So second point is to motivate the people and to make them aware that what are the various types of mental illnesses, what are the various signs and symptoms of these mental illnesses or the diseases, and how they could be prevented or treated. Okay, so in this way, we would be able to reduce the stigma. Next, provide services for the early detection and treatment of the mental illnesses in the community. So it is obvious that if we are launching a program, then this objective must be included in this, that providing of the services for the early detection. That means we are talking here about the secondary prevention. Okay, that is the early detection and treatment. Okay, so we are further preventing the disease in this point, but that includes the secondary prevention. Okay. Next, provide valuable data and experience at the level of community, state, and center for future planning and involvement in services and research. And not just the providence of the services, but also to make our infrastructure, okay, to build our infrastructure so that at the national level, we would be having an infrastructure that would be able to tackle the diseases at the mass level in the population. So under this point, we were trying to strengthen our healthcare system related to mental services. Okay. Next is the components and the schemes of the National Mental Health Program under the 11th Five-Year Plan. So under the National Mental Health Program, different types of components were implemented. That is manpower development schemes and centers of excellence. So as I have already explained you about that, related to the mental health services, we are having the scarcity of the health personnel. So that is why this point here, uh, the point is written here. Second is modernization of the state-run hospital. So if the diseases are new, but we are having the old techniques of tackling with the disease, or the infrastructure is not uh, uh, connected with the innovative ways. So that is why we are in the need of the modernization of the state-run hospitals. So if we will modernize our hospitals or the centers, then we would be able to provide the services in a modern type, like the diseases have advanced from them from time to time. So we have to use the innovative ways to deal with them. That means that the preventive and the treatment measures should be the new ones. Okay. Next, upgradation of the psychiatric wing of the medical college and general hospital. So in each medical college and the general hospital should be also the uh, we can say that the provision of the psychiatric wing that should only deal with the diseases of the psychiatric or the mental issues of the mental dimension. Okay, in each general hospital and medical college, there should be the provision of the psychiatric wing. Next is IEC, that is information, education, and communication. Next is training and research, training to the manpower or the health personnel that would assist or contribute in the mental illnesses or the prevention and the treatment. Next, research for the new ways of the innovative techniques to treat the diseases that are relating or connected with these ones. Next is monitoring and evaluation. Next, first, the explanation of these components is modernization of the state-run hospital. And for this, the assistant under this scheme is provided for the modernization of the state-run hospital from custodial care to comprehensive management. As per the existing state-run mental hospital, a one-time grant with the ceiling of rupees 300 crores. Okay, so that is provided by the government for the modernization of the hospitals. So that is the fund that is provided for the modernization of these hospitals. Second is upgradation of the psychiatric wing. As I have already explained you about that, the grant of 50 lakh rupees is provided to the different types of medical colleges and the hospitals under this scheme, so that they must build a psychiatric wing, or they should be having the infrastructure of the health facility or the teaching staff at the PG level, graduate and PG level, so that we should be having the manpower to deal with the diseases. Next is manpower development scheme. In order to improve the training infrastructure in the medical health, government of India has approved the manpower development scheme. So as the name indicates, manpower development. So manpower development for any of the sector. But in this topic, we will talk about the manpower development for the mental health issues. Next is IEC activities. That is information, education, and communication for the purpose of increasing awareness and removal of stigma for mental illness. They, like many of the persons have various types of misconceptions related to the mental illnesses, like the mental illnesses are due to any type of the presence of the ghost or any type of the non-existing things. Okay, So they take the they go to the different types of the babas or any type of saints, uh, uh, and those saints doesn't know about any type of mental illnesses, or sometimes they uh, provide any type of injury, or the sometimes death of the patient occurs in many of the cases. So there is a need of the information, education, and communication that the mental illnesses are due to the imbalance of the various types of chemical imbalances, or we can say that it is change in the behavior due to the various factors, either due to the stress, depression, tension, or any other thing. So there is a need of the awareness. So that is the point that is doing this thing, that the removal of the stigma for the mental illnesses. So that was all about the program, and at last I have added in this slide that what's the role of nurse in national mental health program. So there are the different roles as the nurse is a important health personnel in national mental health program. First is assisting in early diagnosis and treatment of mental illnesses. So that is, we are talking about the secondary prevention. Second, making special arrangement to protect and take care of the patient to prevent them from physical injuries or attempted suicide. So I would say that there is always a risk that a mental patient can harm themselves, himself or herself, or he or she can commit a suicide. Okay, so the nurse is the person who is always caring the person with the mental illness. So nurse can always protect the patient from any type of illness to himself or herself, to others, and from the suicide. So that is also important role. Next, establishing the importance of the mental health in general patient and telling them the method of attaining good mental health. The nurse can aware the people. She is the person who can provide the or motivate the people that not just the physical health is important, but the mental health is also important. So the general public should follow the healthy ways how to remain mentally healthy. Next, follow up of the mental patients. If there are different patients that are on the various types of taking the medicine related to the mental health issues, the nurse must follow these patients for the improvement. Okay, so that is also the role. Next, conducting guidance clinics. In these guidance clinics, the nurse would perform the activities as a guidance guide or the counselor, so that some of the problems of the mentally unhealthy person would be treated, or for that point, she must act as a guide or the counselor. Next, assisting the patient in social rehabilitation after their treatment. So many of the persons are treated in the tertiary level, at the tertiary level of prevention, that include the social rehabilitation. Okay, so the nurse is also having a role. Last one is providing mental health education during home visiting and hospital nursing and community care. So, nurse is always the person who will provide the services at the home, hospital, or community care, because the patient trusts on the nurse. The nurse is having the responsibility and accountability to provide each and every service to the uh, patient. Okay, so that is all about the role of nurse in national mental health program. Okay. So that was all about the today's topic. I hope you would be able to understand about the topic, today's topic, that was relating with the National Rural Health Mission and National Mental Health Program. Okay, so that was all about the today's topic. And in the next lecture, I will continue with the next topics. It might be either will be relating with the national health programs. Okay, so I will try my best to keep in touch with you, and you must also join me on the live sessions. Thank you very much.